Have you ever felt pain in your back or hips and wondered, are my bones slowly breaking down? You're not alone. Many seniors don't realize their bones are weakening until they fracture something, doing something simple, like bending down or stepping off a curb. Osteoporosis after 60 doesn't scream, it whispers. And often, the first sign is a painful break that leads to a hospital stay for the loss of independence. According to the National Osteoporosis Foundation, around 54 million Americans have low bone density or osteoporosis. And the risk is high. 1 in 2 women and 1 in 4 men over 50 will break a bone due to it. Even worse, in many cases, the first fracture is the first clue. Osteoporosis can silently weaken bones for years before symptoms appear. In today's video, we'll uncover 5 silent signs of osteoporosis seniors often miss, signs that could help you catch bone loss before it leads to a life-changing injury. Stick with me to the end, because the sign you're ignoring could be the most dangerous. And if staying strong and independent matters to you, hit subscribe and tap the bell. We share senior health tips every day, simple advice that could protect your life. Now, I won't keep you waiting any longer. Let's jump right into the first silent sign. Sign number 1. You're getting shorter without noticing. Losing a little height as we age might seem harmless, but it can be one of the first silent signs of bone density loss. According to the Mayo Clinic, many older adults with osteoporosis after 60 experience small fractures in the spine, known as compression fractures. These tiny cracks can slowly cause your spine to collapse, leading to a gradual loss of height over time. You may not feel pain at first, but over time they cause the spine to curve forward, leading to the characteristic stooped posture seen in many older adults. It could be your body telling you something's off. According to Harvard Health Publishing, most people lose about ½ an inch every decade after age 40, but losing more than 2 inches may indicate spinal bone weakening. Take Dame Judi Dench, the iconic British actress. In multiple interviews, she has shared how she's lost more than an inch of height over the years due to age-related spinal compression. While she remains remarkably active and sharp, Judy's experience is a powerful reminder. Height loss isn't just cosmetic, it can be a clue that your vertebrae are silently weakening. Why is this dangerous? Because it changes your posture, throws off your balance, and increases your risk of falling. It can also compress internal organs, leading to breathing problems or digestive issues. If you've noticed even a slight loss of height, talk to your doctor about getting a bone density scan, DEXA scan. The earlier you catch it, the more options you have to protect your bones. Have you or someone you know noticed a change in height lately? Share your story in the comments. It could help others spot the warning signs early. If you think getting a little shorter is no big deal, the next sign might change your mind, because sudden back pain could be your body's quiet cry for help as your bones begin to weaken. Sign number 2. Sudden or unexplained back pain. Let me tell you about Margaret, a 72-year-old who loved tending her garden every morning. One day, she stood up from pulling weeds and felt a sudden sharp pain in her lower back. She thought it was just a pulled muscle and tried to walk it off, but the pain lingered for weeks. When she finally saw a doctor, the diagnosis shocked her. She had multiple spinal compression fractures caused by advanced osteoporosis. She had no idea her bones were that weak. According to the Mayo Clinic, spinal compression fractures are among the earliest signs of osteoporosis and can occur even without any traumatic injury. Actions as simple as bending forward, sneezing, or lifting a lightweight object can create tiny cracks in the vertebrae when bone density is severely reduced. What makes this symptom dangerous is that it often mimics common muscular pain, leading many seniors to delay medical attention. So what can you do? If you're over 60 and experiencing new persistent back pain, consider incorporating gentle weight-bearing exercises such as walking, stair-stepping, or Tai Chi into your daily routine. These movements help stimulate bone-forming cells and improve posture and balance, reducing the risk of spinal fractures. In addition, make sure you're getting enough calcium and vitamin D2 nutrients essential for keeping bones strong. Experts recommend 1,200 milligrams of calcium and 1,000 IU of vitamin D daily for adults over 60. These can come from food sources like leafy greens, dairy, salmon, and fortified cereals, or from supplements if your diet falls short. And coming up next, I'll reveal the most overlooked symptom that even active seniors often miss. It's one you likely wouldn't expect, but it could make all the difference if caught early. Sign number 3. Brittle or easily broken nails. You might not realize it, but your nails can reveal surprising clues about your bone health. They're more linked than most people think. According to the Journal of the American Geriatric Society, brittle nails in seniors can be an early red flag for low bone density. That's because bones and nails share many of the same building materials like calcium, collagen, and protein. When the body is running low on these essential nutrients, it prioritizes vital functions like organ health, leaving structures like nails and bones more fragile. Let me tell you about Nancy, a 70-year-old piano teacher. She began noticing that her nails would crack just from washing dishes or playing piano. At first, she shrugged it off as just aging, but a visit to her physical therapist suggested something deeper. After some testing, Nancy was diagnosed with osteopenia, an early stage of bone loss. Here's why it matters. When your nails weaken, it could be your body signaling that your bone matrix is breaking down too. This structure needs more than just calcium. It needs collagen, silica, and biotin to maintain its strength. To support both nails and bones, add silica-rich foods like oats and leafy greens to your meals. Consider collagen peptide supplements, especially hydrolyzed collagen, which is better absorbed by older adults. And don't forget hydration. Dry, brittle nails often worsen when the body is dehydrated. If you're finding this tip helpful and want more practical advice to stay strong and independent after 60, like this video and subscribe now. We share easy, proven health strategies for older adults every day, so don't miss out. If your nails are trying to tell you something, your gums might be whispering the same warning, only quieter. Let's move on to another overlooked signal hiding in your smile. Sign number 4. Receding gums, a hidden clue to bone loss. It may come as a surprise, but your gums can actually reflect what's happening with your bones, often before any other symptoms appear. Dr. Linda Chen, a dental specialist with over 25 years of experience, recalls her 70-year-old patient, Mr. Harris, who came in for sensitive teeth. She noticed advanced gum recession, but what truly alarmed her was the root-cause jawbone loss. Most patients don't realize their mouth can be the first place to show signs of bone loss, she explained. The jawbone anchors your teeth. When it weakens, gums begin to pull away, making teeth look longer. This isn't just a cosmetic issue. It can lead to loose teeth, infections, or even fractures in older adults. According to the Journal of Periodontology, there's a strong link between gum recession and low bone density, particularly in postmenopausal women. It's subtle, but it may be one of the first warnings your body gives you. If your dentist mentions gum recession, or if you've noticed your teeth look longer than they used to, it might be time to ask whether bone loss could be involved. Beyond good dental hygiene, there are several targeted strategies that can help protect your jawbone and gums. Ask your dentist about getting panoramic x-rays every 1 to 2 years to keep an eye on jawbone health. Including collagen-rich foods in your diet, such as bone broth or chicken skin, can support both gum tissue and the bone matrix. It's also important to avoid smoking and limit excessive sugar intake, as both habits can accelerate gum recession and bone loss over time. Did this hidden sign of bone loss catch you off guard? Have you noticed your gums pulling back or looking different lately? Share your experience in the comments. Your story could help someone recognize the warning signs early. If you're feeling uncertain about the signs mentioned so far, then listen closely to the final sign I'm about to share, because most people over 60 believe this is just a normal part of aging. Sign number 5. Difficulty bending, twisting, or reaching. Many older adults start to notice it. Twisting to grab something behind you, bending down to tie your shoes, or reaching for a shelf suddenly feels harder. It's easy to chalk it up to just getting older, but in many cases, this subtle stiffness is one of the first signs your bones are weakening. Take Mr. Allen, a 69-year-old retired driver. He thought his back stiffness was just age catching up, but one morning while twisting to grab a cereal box, he felt a sudden twinge. It didn't seem serious until he couldn't stand straight for days. X-rays later revealed a small compression fracture in his spine, caused by early-stage osteoporosis. Why does this happen? As your bone density decreases, especially in the vertebrae, they become more vulnerable to pressure and rotation. Even everyday movements like bending or twisting can create tiny fractures or compress the spinal bones. But instead of feeling sharp pain, you often feel gradual stiffness, reduced flexibility, or a tighter back. That's why it's so easy to mistake for normal aging. According to the Journal of Bone and Mineral Research, subtle mobility limitations like reduced trunk rotation or difficulty bending may be predictive of spinal fractures in seniors with undiagnosed osteoporosis. Don't dismiss these mobility changes. Incorporate gentle core strengthening and mobility exercises like seated spinal twists, pelvic tilts, and slow side bends. These movements improve flexibility and spine support. If mobility changes appear suddenly or worsen, ask your doctor about assessing your bone health. If you're struggling to do movements that once felt effortless, don't just blame aging. Your bones might be whispering for help before they break. So now you've learned the 5 silent osteoporosis symptoms that many seniors miss until it's too late. Remember, osteoporosis doesn't always show up as a big warning. Sometimes it whispers through your back pain, your posture, or even your gums. But the good news? You're not powerless. By catching these subtle signs early, talking to your doctor, and making simple lifestyle changes, you can protect your bone density, prevent dangerous fractures, and stay independent longer. Don't brush these signs aside as just getting old, because your bones deserve better, and so do you. If this video helped you recognize any of these symptoms, consider sharing it with a friend or loved one. You never know who might need this information. And if you'd like to learn how to build stronger bones through nutrition, safe exercise, and daily habits, check out our playlist, Strong Bones and Joints. It's full of practical tips just for you. Don't forget to like this video, subscribe to the channel, and turn on notifications so you never miss out on trusted health tips for staying strong and independent after 60.